Meanwhile, the number of patients with COVID-19 continues to go down in Ballad hospitals. Today, the health system reported 63 patients in their hospitals with confirmed COVID-19. That's down from 100 cases at the beginning of this month. 14 of the Ballad patients in the hospital tonight are in intensive care, and 7 are on ventilators. Ballad Health Chief Infection Prevention Officer Jamie Swift joins us again once again this evening via Skype. Jamie, thanks so much for your time. We appreciate it. All right, Jamie, we're wanting to make sure you can hear me. Can you hear me all right?
I can. Can you hear
great.
me?
Okay, problem solved. Thanks so much.
All right.
Let's first deal with numbers that you're seeing, that downward trend. When we spoke with you last week, you're saying that the surge that we saw in deaths was as a result of a surge in hospitalizations and new cases a couple of weeks to even a few months ago. What are your thoughts on this, what apparently is a downward continuing trend in new cases and hospitalizations?
Yeah, we're continuing to see our numbers go down right now in hospitalizations. You know, I think new cases are kind of steady right now, and certainly steady at a level that we don't want. We want them to be much lower. So, I don't want us to celebrate too much because our steadiness is certainly still higher than what we expect. You know, with hospitalizations, not all of those outcomes were good. So certainly our numbers have went down, but as you all have seen, we've had several deaths recently, and so people need to understand that we're still seeing severe illness in the region.
Jamie, we are hearing, and I want you to tell us what you know tonight about the occurrence of COVID-19 in children in our area. Are you seeing an increase in pediatric cases, and what kind of numbers can you give us?
We are. So we have started to see an increase in pediatric cases, specifically those school-age children. We've seen some college-age children. So, you know, it's not surprising. We knew that this could happen as kids start mingling together again. It's really just a reminder to parents to stay diligent. You know, we've seen children that have had to be hospitalized with COVID. Even though most kids do really well, we have seen some hospitalizations, and we have started to see some of that MIS-C syndrome, which is that multi-inflammatory syndrome in children that we know is a complication of COVID. And so we've started to see some of that in our region as well.
And I want to ask you more about that, but getting back to the new occurrence, are we talking a handful of kids in your hospitals tonight? Or give us an idea of the extent to which you are seeing kids coming into your hospital sick with COVID-19 and needing to be hospitalized.
It's very few that have to be hospitalized. You know, I don't go into numbers right off the top of my head, but it's very few that have to be hospitalized. But we want people to understand it does happen. And so, you know, it can cause severe illness in a child. Most of the time our children are going to do extremely well. You know, we really worry about who the kids are going to spread it to. So we don't want to cause fear and panic. We just want parents to be aware, but certainly to be aware for symptoms, to be aware of making sure our kids are still trying to social distance, wear a mask, and do all the things they need to do.
You know, with all populations, we've been told all along that pre-existing conditions can sometimes make it harder to deal with COVID-19. Does that apply as well for kids, those who maybe have already been dealing with health issues, maybe through Niswonger Children's Hospitals? Or do you find that those are the ones that are oftentimes ending up in the hospital?
I'm not sure on our exact cases, but, you know, I think science would tell us yes. If you've got a child with underlying chronic respiratory conditions, most likely they could have more issues with COVID than your average healthy child.
You mentioned multi-system inflammatory syndrome. MIS-C, is that correct? Is that the way it's referred to? What is that? And you're saying you are seeing that in your hospitals. Give us an idea as parents. What do we need to know?
Yeah, so there's a lot that's unknown about it. So, you know, we've seen this across the nation. This emerged a few months ago. It's a complication that we think most likely is related to children having COVID. It really is just inflammation of the various organ systems. So they end up having inflammation of the heart, lung, brains, various things. And so there's various symptoms. If they've had COVID, they're sick, you really want to seek care and make sure your doctor knows that they've had that history of COVID and seek care if you start seeing any of those symptoms.
Is it treatable? I mean, are you seeing kids recover from this multi-system inflammatory syndrome?
We are across the nation. So, you know, typically kids seem to recover once they seek care and are in the hospital and are being treated and it's diagnosed. We are seeing that so far there seems to be a good recovery from this.
As we speak, in Washington County, Virginia, we have parents who are wanting school board members to let their kids back into class. It's happening more and more across our district. Do you think that this increase in pediatric cases could be linked to kids just being in large groups more than they have been in months and months?
You know, it's really hard to say, but I mean, you have to take all those things into account. You have to take into account community spread and have adults giving it to children, or is it the fact that, you know, kids are going back to school and sports and athletics and gathering a little bit more. So this in no way, it's not necessarily surprising. Everywhere that's had schools reopen has had an uptick in cases. You know, the important thing is to have the information, understand that there could be COVID transmission, to have that very low threshold to keep your child at home if they're sick, not send them to school with any symptoms, and to seek that medical care and get tested.
And talk about hand washing and mask wearing. I would think those are important conversations to keep having with your little ones.
They are, and we're seeing kids really as young as 2 can wear that mask. If you have that conversation, teach them, model that behavior. Our kids are doing really well wearing a mask. They understand, and it seems to be going okay.
Jamie Swift with Valid Health, thanks, and please, our best to those kids and their parents who are getting care tonight. We appreciate it.
Thank you.